to this event, which is co-hosted by the World Health Organization and the Republic of Indonesia. It comes 4 years after the first high-level meeting of the General Assembly on TB in 2018. And you will recall that that meeting endorsed a very ambitious and powerful political declaration with several targets and very ambitious goals, which have been severely set back in the last 2 years. We have less than a year to reach some of those targets, which were benchmarked to be achieved by the end of 2022. And global efforts, despite our best attempts to save millions of lives, have fallen somewhat short. The pandemic has paired with several other crises to affect the work that we are doing in a negative way. And so there is a dramatic need for us to step up efforts and investments to bridge the gap in the fight against TB. The aim of today's meeting is threefold. First, to review progress we have made on global and national targets. Second, to discuss approaches for sufficient and sustainable financing. You will recall there were ambitious targets in the 2018 declaration for financing research and development. And third, to highlight strategies that can accelerate such research and innovation of new tools, including effective TB vaccines and leveraging lessons learned, because there are many out there that we can share, particularly in relation to the COVID-19 pandemic. This event will also serve as a very, very valuable platform for us as we launch into the momentum for the next high-level meeting on tuberculosis, which is in 2023 here in the General Assembly. We will have 3 sessions, an opening segment, and then there will be a ministerial level panel discussion. And then the third segment will be a panel discussion from among partners, because without partners we cannot achieve the goals we have set for TB. We have a very distinguished lineup of speakers with several ministers to whom we are very grateful, and senior government representatives and champions from civil society that have long been with us in the fight against tuberculosis. So if there is time, we will gladly have questions and answers at the end, which we hope we will. Let me first now, without further ado, address Dr. Tedros, who is our Director General in WHO. Thank you, Dr. Tedros, for your commitment to ending TB as part of the efforts to reach universal health coverage. You have the floor, sir.
Thank you, Governor. Your Excellency, Minister Budi, Honorable Ministers, distinguished delegates, dear colleagues and friends. I thank my friend Minister Budi and the government of Indonesia for your leadership on health and for prioritizing TB as part of your G20 presidency.
So now it's okay.
Tuberculosis remains one of the world's leading infectious killers. Despite being a preventable, treatable, and curable disease, this ancient sport kills more than 1.5 million people each year and affects millions more. The impacts on families, communities, health systems, and economies are enormous. Let me remind you that in the Sustainable Development Goals, all countries are committed to ending the TB epidemic by 2030. This is no small ambition, but the gains we have made in recent years gives us hope that together we can achieve it. In the last 2 decades, more than 66 million people have received access to TB services. Deaths from TB have dropped by around 40% since 2000. But this hard-won
gains are at risk, as we all know. The COVID-19 pandemic has set us back, disrupting essential services to prevent, detect, and treat TB in many countries. As a result, WHO has reported an increase in TB deaths for the first time in more than a decade, and that's very tragic. Conflicts in Afghanistan, Ethiopia, Syria, Ukraine, and Yemen are further jeopardizing access to services for people with TB. To get back on track to meet the TB targets of the SDGs and WHO's End TB strategy, we need strong leadership in high-burden countries and from the international community. I would like to emphasize 3 priorities for action. First, we urge countries to intensify efforts to restore essential life-saving TB services that have been disrupted. Rapid uptake of the latest WHO policies on TB prevention and care can significantly improve outcomes of those affected. This is the only way to end preventable TB deaths. As COVID-19 and TB have similar symptoms, we need wide testing for both diseases so that people can get the treatment they need. Second, we need to urgently scale up investments to increase access to services for TB prevention and care to accelerate progress towards the 2022 targets, because lives depend upon it. Today, less than half of $13 billion annual funding needs are met, even though we know that investing in ending TB is highly cost-effective. Again, I thank Indonesia for highlighting this shortfall as part of its G20 presidency. Increasing domestic public financing is the most sustainable way of closing this gap as part of every country's journey towards universal health coverage. At the same time, countries with weaker economies have inadequate fiscal capacity to expand public financing, especially following the enormous socioeconomic impacts of COVID-19. These countries will need additional external support in the short and medium term. We must also remember that progress in public health depends on innovation. Financing for TB research must at least double to successfully drive discovery of new tools, including vaccines. To intensify vaccine development and building on lessons from the pandemic, WHO plans to convene a high-level summit early next year. This will support the rollout of the global strategy for TB research and innovation endorsed by our member states. And third, we urge all countries to integrate services for TB into primary health care as part of their journey towards universal health coverage. The struggle to end TB is not just a struggle against a single disease. In many ways, TB is a symptom of how our societies have failed marginalized communities. It's also the struggle to end poverty, inequity, unsafe housing, discrimination, and stigma. Ending TB is not a job for the Ministry of Health alone, as a result of all the things I have outlined. We need action and greater accountability from countries, partners, and civil society across all sectors to end TB. A year from now, we will meet again for the second high-level meeting on TB to take stock of progress and to re-energize commitments to end TB. In the coming months, WHO will work with the offices of the Secretary General and the President of the General Assembly to prepare for that meeting. If the pandemic has taught us anything, it's that with solidarity, determination, innovation, and the equitable use of tools, we can overcome severe health threats. Let's apply those lessons to tuberculosis. It's time to put a stop to the long-time killer. Working together, we can end TB. I thank you. And back to you, Anna.
Thank you very much, Dr. Tedros. I would now like to invite the Honorable Minister of Indonesia, Dr. Budi Gunadi Sadikin, to deliver the next opening address. As you may know, Indonesia holds the G20 presidency, and they have placed a spotlight this year on ending TB, building on the outcomes of the G20 Health Working Group and the call to action on financing the TB response. I'm sure he will tell us more about that. Minister, please.
Dr. Tedros, ladies and gentlemen, I just realized standing here in this wonderful building is my 1 year and 9 months as health minister. I came as a health minister during the worst time, I can tell you. After 30 years as banker. And I've seen many bad and ugly times. I've seen the worst pandemic. I've seen many Indonesian, went to hospital looking for oxygen, dying. Even as a health minister, couldn't help my friends and family, bringing them to hospital or getting oxygen. It's a very dreadful experience, even as a health minister. And after that, also I realized I learned a lot about health. And I realized that this tuberculosis has been with us for 140 years. And still infected more than 10 million people every year and kills more than 4,000 people a day. And Indonesia ranked between number 2 and number 3 globally. I also realized that it kills more people than COVID in Indonesia until now, accumulatively. So it is a very bad diseases for Indonesia. I just also back from Global Fund replenishment. HIV, malaria, tuberculosis. So I also realized that this tuberculosis is a poor people and poor country diseases. So as a representative from poor country, Indonesia is still categorized as lower middle income country, I can feel that. Why tuberculosis has been there for many, many years, for 140 years after Koch discovery of this bacteria. But ladies and gentlemen, let me share with you, all of those dark side, there always be a bright side. As a 30 years bankers, I've seen many global financial crises. And for every major crisis, there are always major opportunities. Only through great earthquakes, lofty mountain rises. So this major pandemic, global health crisis, open up an opportunities also for me that I learned. Let me share the numbers, Indonesian numbers. Since I joined in December 24th, 2020, so one day before Christmas and 7 days before the first peak of Alpha variant in Indonesia. We have tested 64 million PCR or molecular tests. We have got 6.4 million positive COVID-19. We have vaccinated 204 million people, and we have vaccinated 438 million doses of vaccine. And you know that the COVID-19 vaccine has been rolled out in less than 2 years. That were the bright side of how health technologies for infectious diseases happens. As a non-health professionals, when I see this, then my question is, why these good things did not happen with TB? That is my question. Because when I see this, it is quite amazing. TB in Indonesia is only 824,000. And we just have our 77 years anniversary. So if we can do tests 64 million in 1 year and 3 months, why can we do tests and found 6.4 million people infected? Why couldn't we found 834,000 in 77 years? We should be able to do it, right? And then I realized that the problem is only with one word, is commitment. Whether we are committed as a leaders, whether we are committed to put enough resources, attentions, budget to do it. So I talked to my friend, I talked to the president, if we want to end TB by 2030, then we really have to commit ourselves of doing it. So let me share with you what is our plan, at least in Indonesia, to do it. First, I changed the target. So I said, I only have 3 years and 9 months as a minister because I'm replacing someone before me. And I spent already 1 year and 3 months, do this vaccination and, overcoming the pandemic. So I only have 2 years and 6 months left. So I'm very calculative on everything. And I can be very brutal as an ex-CEO of the largest bank in the country and giving a target. I only have 30 months. So in 30 months, I said to my team, I want you to identify at least 90% of those 824,000. It's not millions, it's only 1,000. If you cannot, then I will use a brutal force, as an ex-CEO of a bank. Bankers are very brutal person, As I said to Peter Sen said, would you help me raise 18 billion fund? Peter, and I know, as a 30 years bankers, maybe each of us has raised $1 trillion for our client. So 18 billion is nothing in terms of money because we raise trillions of US dollars. But Peter, in terms of amount, it's a huge amount. But in terms of value, we feel it is so small value to humanity. This 18 billion global fund raise for tuberculosis, HIV, and malaria, for us bankers, is small. But in terms of value to humanity, I feel it's the biggest value that I can contribute to humanity, Peter. And I think you should agree with that. So congratulations for Global Fund and all. I think I can recover my sin raising so much money for something, that is not good for humanity and move in health. I wish I work in health for 19 years instead of 1 year and 9 months here. So that is what we will do. We will increase our surveillance. We have 10,000 puskesmas, primary health workers, and 300,000 community workers across the country. We will standardize and push the surveillance mechanism. We learned that India has a cheaper methodology how to do it. I asked the team from Stop TB Partnership, can we contact India to reduce the price by 1/2 to do it? We will do whatever we can. We will allocate budget to do it. We can help from Global Fund to get increased money, how to do it. And we'll allocate also a national budget, to increase the surveillance. I want to get 824,000 done. And I just realized that we can reduce our testing from COVID from before is around $100 when we start do testing, PCR test for COVID, to $10 in 12 months. So we should be able also to do that for tuberculosis testing. Now it's around 20 to 30 US dollar. We should be able to reduce it to $10 and $5, and that it will become very, very massive. In PCR testing for COVID, we start with only like 50 labs, PCR labs. Now in 6 months, we can accelerate to 1,000 labs across the country. And I realized that this PCR technology, I'm not a technologist by myself, but this PCR molecular testing is very, very similar with whatever we do in tuberculosis. So if we have 1,000 labs across the 17,000 islands in Indonesia that can do PCR testing, it should be able with some slight changes in technology that we can do also testing. So that is on the surveillance side. On the vaccine, Dr. Tedros mentioned to me, Budi, we need to do also something with the vaccine. Vaccine in COVID-19, unprecedented, 22 months, a lot of vaccine available. So I said to Peter, you had 18 billion, why don't you spend some of them, to develop a new vaccine? And then I approached many other global institutions. We had dinner yesterday, and Bill Gates was there. I talked to Bill. Bill, I know that, I talked to Jeremy Ferrer, Wellcome Trust, found there is one entity that successfully found a good candidate for tuberculosis vaccine, but they don't have enough money, so they transfer it to Bill and Melinda Gates Foundation. Now Bill and Melinda Gates Foundation will push this, and they are looking for a country to do clinical trial 3. I said, I will be participating. So I will be participating as an international locations to do the clinical trial phase 3 for this tuberculosis vaccine, because I have the populations, and I can contribute also some funding, and I have also researchers and vaccine manufacturer PQ WHO. Dr. Tedros knows that can help. And hopefully that will start also, and the next generations of tuberculosis vaccine will be available very, very soon. In G20, we are talking about the new research and manufacturing hubs for mRNA technology. So this is the future technology of vaccine. We just have the SAPI board meeting in Bali last week, and SAPI is very, very committed to establish a mRNA technology in global south countries, so we can develop the next generation of vaccine less than 100 days. So if this available, and the team is already working on this, hopefully then the next generation of vaccine based on mRNA technology will be spread over the world and will be able to produce vaccine faster than what we have seen before. So a lot of initiatives are moving into the right directions. In closing the speech, I would like to remind us that in 2018, the United Nations General Assembly actually has an unprecedented political commitment to ending tuberculosis in 2030. And next year, in 2023, we have a 5-year review window to ensure that political commitment remains as strong as they are. And Indonesia is very committed that we will co-facilitate as the representative of the lower and middle income country that have a lot of tuberculosis patients, and that are the country that is committed, to accelerate to end TB by 2030. And today I would like also to pay tribute to all of you, experts, practitioners, policymakers, business leaders, community workers, for your continued support and unwavering commitment to make the world free of TB by 2030. And remember about the word commitment. This morning, I'm a Muslim, so I cannot eat bacon and egg. But I always say bacon and egg is a good example between commitment and involvement. Because to be available on your table, the chicken is involved. So for you to eat the egg, the chicken are involved. But for you to eat the bacon, then the pig has to be committed. Thank you.
Thank you very much, Minister. I think you have shown us now what we have missed since 2018, because we had political commitment, we had the health sector, civil society, but we missed the banking sector. Now that you're on board, I have hope, and I think all of us do. The last speaker to round out the opening is someone from civil society. Her name is Jackie Quinn. She is a TB survivor and an advocate from We Are TB, a community of people that have been through the disease and are currently still in treatment. Please, Jackie, can you bring us your perspectives?
Hi, everyone. My name is Jacqueline Quinn. I'm a TB peer support navigator with We Are TB, an advocacy group, an advocacy and support group for those who have been impacted by tuberculosis. I was diagnosed with active pulmonary TB on February 12th, 2019. And I'd like to point out that I use the word survivor very reluctantly, because it's my personal belief that over a century later, nobody should be forced to succumb to the fatalities of TB. Tuberculosis is a disease that for some of us is very complex to understand. It is a disease that's not easily spread until it is, and like many others, it can mask itself as a harmless seasonal sickness. But unlike as many, it can sleep in your body for a lifetime without ever manifesting itself. And how can one demand patients to go through such a tough and long treatment when said patients may never attain the peace of mind that comes with a negative tuberculosis test? And that's how my story begins, with sheer ignorance. Growing up in a city in Mexico that is widely, where tuberculosis is widely prevalent, I never imagined that what felt like a simple, prolonged cough would turn out to be a deadly disease that would change my life forever. I asked, tuberculosis? Isn't that a disease of the past? One that causes people to cough up blood and vanish, shortly thereafter? A disease that you only test for when your work requires interaction with the elderly or impoverished communities? Weirdly enough, my first thought was not that I was going to die. I figured if I hadn't heard about that ever happening to anyone, then it probably meant that it was rare. And people who get a positive skin test usually claim that it's because of the vaccine. So I was certain that my doctors in San Diego would know how to handle such an old disease. So I wasn't particularly worried about TB posing a threat to my life, but I was definitely worried that that it would compromise my professional career, that it would end it before it began. I had hopes of becoming a dentist, and again, I was afraid that this diagnosis was going to compromise that outcome. I suppose I was fortunate enough to be ignorant, because had my internet search yielded all the information that I now know about TB, it would have imposed a lot more stress than had already built up by then. Unfortunately, my TB journey saw ignorance in more than one instance. The diagnosis was not exactly intuitive to my attending clinicians. I went from being misdiagnosed with pneumonia to getting mocked at the emergency room for seeking a second opinion when I was already told I had pneumonia, to a diagnosis of valley fever, which is a disease caused by a fungus. So 3 weeks and multiple new symptoms later, I opened several alarming voicemails while taking a lunch break at work. And it turned out that my culture for Mycobacterium tuberculosis had grown, which meant that I had to follow a strict set of rules in the following days. One of those rules meant that I had to set up a follow-up appointment with my pulmonologist. And lucky me, they were able to book an appointment for about 6 days after that call. And I thought, I've been waiting this long, and now I have to wait another week to potentially get a prescription. So not a chance, no. And not with the support system that I had. So then I had to advocate for myself, get another set of analyses, and get a hospital referral, which turned into a 3-week stay at the hospital and a 10-month-long treatment. But how did I have the energy to stand up for myself for so long, to so many people, and while feeling sick and weak at the same time? Like I said, it was my support system. So I'm fortunate enough to have very close family members who happen to be physicians in Tijuana, Mexico. That's my hometown. And they actually kept tuberculosis on their radar from the moment they heard me cough that winter. The wait for me to receive care got so frustrating that I considered seeking care in Mexico. But the main reason I didn't follow through with that was because it meant that I had to seek hospitalization in Mexico, which unfortunately meant that I was less likely to encounter the latest TB treatment that may be available elsewhere, probably in the United States. So my circumstances got me thinking about how some areas of the world are richer in knowledge while others are richer in resources. This disconnect is unproductive all around. And I can honestly say that I lived my worst day yet during the early stages of treatment. And yet I personally consider my story to be the best case scenario. Sadly, misdiagnosis has become almost a staple in each of my peers' stories. And quite frankly, I think it's unacceptable. This is what encouraged me to join We Are TB. Through this group, I've worked with numerous people across the globe who are also struggling against the disease or its aftermath. They all have different backgrounds and unique stories, and they've provided me with a perspective I never thought I would gain. I'm proud to call these people my peers, and as I mentioned earlier, my support system is what got me through the dark times that more often than not accompany a positive TB diagnosis. So I would like to offer the support system to others and help empower them to become advocates for themselves or anybody else in need. So I would like to ask for your urgent action on 3 fronts. Prioritization of ending TB in the global health agenda across all countries, those with a heavy burden and those without. As TB can strike everywhere and anyone, essential prevention, diagnosis, and care must be available for all as we look towards a universal health coverage. We need shorter treatment. New shorter regimens without any injectables and rapid tests should be available to everyone everywhere upon diagnosis. We need new research and development. COVID vaccines were developed unbelievably quickly, as it's already been pointed out. So why are we still using a vaccine that is not that effective 100 years in? Like most of you in this room, I too refuse to give up the fight against tuberculosis, and I hope that my story helps shine a light on the urgency to take action, because TB anywhere is TB everywhere. Thank you.
Thank you very much, Jackie. I'm now going to ask my colleague Monica Diaz to moderate the rest of the discussion. The first segment will be a ministerial panel, and then that will be followed by civil society and stakeholder discussion. Please excuse Dr. Tedros, who needs to move on to his next appointment. Thank you very much for coming, Doctor. I believe the minister may stay a little longer, or if he doesn't, we are also very happy that you graced us with your presence. Monica has promised to be a much stricter moderator than I am, so she's next in line.
Thanks so much, Werner. And greetings, colleagues. I'm Monica Diaz from the World Health Organization Global Tuberculosis Program. And I'm very pleased to moderate this high-level ministerial and global leader panel. So we have a great lineup for discussion. We have with us the Honorable Ministers of South Africa and Malawi, the Ambassador for Global Health from France, the Assistant Secretary for Global Affairs, Department of Health and Human Services from the United States of America, and the Assistant Minister for Global Health and Welfare from Japan. I'd like to invite you to please come and take the stage, Honorable Ministers and other high-level representatives. So Honorable Dr. Mathume Joseph Fala, if you could please come join us. Honorable Dr. Kumbize Chiponda, Her Excellency Ms. Stephanie Seydoux, Ms. Lois Space, and Mr. A.G. Hinoshita. May we please invite you to take the podium, please. Please come have a seat. Honorable Minister, please. Honorable Minister, please. Please take a seat. Thank you for being here. So we're very happy to have this distinguished panel with us. We've already heard from the Honorable Minister of Indonesia, who is the co-host of the event, perspectives from the country. And here we have a much broader panel with us. The focus of this panel discussion is going to be on sharing of progress towards achieving the 2022 high-level meeting targets committed by heads of state at the 2018 UN high-level meeting on TB, especially in the context of the COVID-19 pandemic that has reversed progress. Key actions taken to strengthen and build multisectoral engagement and accountability to end TB, and the perspectives of countries looking ahead to the 2023 UN high-level meeting that will bring together heads of state again to spotlight ending TB. So to start with, I'd like to first invite the Honorable Minister of Health of South Africa, Dr. Mathume Joseph Fala. South Africa is a leader in rolling out innovations to end TB, from rapid diagnostics to new drugs to preventive therapy. They are leaders in research and are part of the BRICS TB Research Network. South Africa actually in 2018 was instrumental in pushing for the first UN high-level meeting. So I'm very pleased to invite Honorable Dr. Fala, Minister of Health of South Africa, to deliver his statement. The floor is yours.
Thank you very much. I hope this is on. Okay, thank you very much, moderator, for this event. Good afternoon to our host Minister of Indonesia, Minister Budi, in his absence, and also to the DG. We're indeed very pleased to come and share a few thoughts with this distinguished guest, and greetings to my colleagues, the panelists, and ministers. Also, my colleague is there on the table, Minister of Ethiopia. On the 24th of September last year, His Excellency Abdullah Shahid, the President of the 76th session of the UN General Assembly, reminded us about the political declaration which committed countries to ending TB by 2030. The goal of the declaration was to ensure that 40 million people had access to diagnosis and treatment by this year. Now, at that time, no one would have anticipated the advent of COVID-19, now, which has caused a lot of disruption to all our programs. It has caused a detour. Hopefully, it's just a detour and we can be able to recover. This disruption meant that in many of our countries, and we are one of those, few people were tested for TB, and few of those who tested, especially during the hard lockdown, were actually linked to treatment and care. And we even also lost a lot of people who were already on treatment to follow up, so defaulter rate increased. The reality of the situation is that as the result of the COVID-19, a lot of resources were put into fighting COVID because it was such a high pressure, where unlike TB, where it takes quite some time before people get seriously ill. And with COVID as a pressure where people got seriously ill within days and even succumbed, we put a lot of our resources, financial, physical, human resources, into tracing, in terms of putting our community health workers and all other resources into fighting the pandemic. And in the process, the declaration which we have committed to on managing tuberculosis, controlling the spread of TB, and making sure that we can reduce its impact and eradicate it by 2030, definitely did suffer. Indeed, this has been a major crisis, and we hope that this is hopefully behind us. We know COVID is still in our midst, but we hope the acute phase doesn't come back. Now, when the restrictions eased, we realized that we had fallen behind quite a lot in our targets. Hence, we developed a plan for continuity of essential services, while at the same time still dealing with the pandemic, continuing with vaccination. Now, this was one of the measures that were taken to continue to make sure that we can manage the pandemic while also catching up with the lost ground in as far as TB and other diseases are concerned. Coming back to TB, in our country, we have recorded the TB incidents having reduced from around 450,000 in 2015 to just around 330 by 2020. But not all those were on treatment. Those who were diagnosed, not all were diagnosed and not all were put on treatment. So our treatment target was still short of even the 90%, and less in terms of sustaining the treatment. So now this was obviously made worse by the pandemic. So as a result of that, we had to take practical steps to accelerate our performance in line with the political declaration of 2018 of our heads of states. So as a country, we have then developed a TB recovery plan, which is a national plan to address all these detours in our services, or also the failure to track and trace those who were not picked up during the pandemic, acknowledging that even during the pandemic, we still have a shortfall. We have decided that as we reset and recover our systems, we need to pay special attention, not to all the areas, including non-communicable disease, but specifically to TB. That it must be integrated into our recovery, and also a focused plan for recovering on TB. This plan is also the foundation on which we are developing a new national strategic plan for HIV, STIs, and also TB, which we will be launching. We are now at the end of our current strategic plan, and we'll launch a new strategic plan at the beginning of next year. So as a country, we have also just come back just over a few days ago. I closed the TB, we had a national TB conference, which I closed on the afternoon of Friday last week on the 16th. This conference was attended by various stakeholders from local authorities, provincial authorities, and national government, and also private sector and civil society. Also TB managers at the district level, at the regional, and also at the national level. This was to recommit the whole of society towards this national recovery plan. So it's going to be beneficial. We felt it was beneficial that all our sectors should pull together in implementing the national recovery plan. We want to also mobilize other role players within the private sector. Also in our country, we also have traditional leaders. We have to make sure that we mobilize them, faith-based leaders, and as I said, civil society and business. So these are all the sectors which we want to make sure that we will be working together in implementing our national recovery plan. So we want to assure all our colleagues gathered here today that as a country, as a government, and as all of government and society, we are going to pull all stops to make sure that we can get back on track in implementing the 2018 commitments. Thank you.
Thank you, Honorable Minister, for your strong commitment towards ending TB and for all the key actions that the country has taken to get back on track. It's really impressive, inspiring. Thank you. I'd now like to turn to Honorable Dr. Kumbize Shiponda, Minister of Health of Malawi. We are very pleased to have you with us here today. While not among the top 30 high-burden countries, TB remains a public health problem, continues to remain in Malawi, and the country is really advancing efforts to combat this disease. We are very appreciative, and we look to you for your statement, Honorable Minister. The floor is yours.
Thank you so much, the moderator. I'm honored to be here to share Malawi's journey in the fight against tuberculosis over the years. The last 10 years, the estimated instance of tuberculosis in our country was about 350 per every 100,000 mark. 7 years ago, which is 2015, the instance was about 187 people per 100,000, while mortality was about 68 per 100,000. A lot has happened. We have achieved a lot in the last, let's say, 7 years to be where we are. As I'm talking to you from the data from 2020, our instance is about 131 per 100,000. And we are targeting that at least by the end of this year, we should be around 100 people per 100,000. Now, in terms of mortality, like I said, 10 years ago, we were about 68. But by the year 2020, we were about 36 people per 100,000. I know 36, it seems that we have really come from far. But 36, that is a number too many. We are talking about our people, we are talking about our women, we are talking about our men, we are talking about those who had been productive citizens of the country. So that is why, as a country, we are very much committed that indeed, as already said by the DG and also the Minister of Indonesia, that all of us, we need to hold hands in order that we end TB by the year 2030. But we are counting. 2030 is only 8 years from now. This is 2022. So if you are saying we, from last 10 years, incidence was at 350, now we have come to about 131 in the last 10 years, yet we only have 8 years before 2030. It means we have to do much, much more than what we have done in the last 10 years. Because we could not achieve to at least have or even just get to a quarter of what it was there. So it means we need to do a lot. Now, in terms of testing, we do a lot of testing, but we have also intensified, especially in the tuberculosis affecting children. Between the year of 2018 to 2023, we had about 6,497 children who were diagnosed and also treated with TB. The biggest challenge in our country has been infrastructure, especially in the rural areas. We lack infrastructure. 60% of our people, they live in the rural areas. And that is a lot. And some of them, they have to walk up to now 10, 15 kilometers just to have an access. You can imagine somebody who is already sick, who is already weak, to walk all those kilometers. So as government, apart from the physical infrastructures like health facilities, we have also introduced mobile testing. We have about 10 vans which have been fitted with laboratory services equipment, including for PCR testing as well for TB. At least we are using those in the hard to reach areas. But we have also included the stool-based expert for testing, especially in the children, apart from the X-ray services. Another issue which I think it is important to bring it out, it is about the drug resistance, which is happening amidst our community. In the year 2020, we had about 550 drug-resistant cases which were identified and treated. So you can imagine 550 are those who maybe for some other reason they find themselves in our facilities. It means there are so much more in our communities, but they might not even be aware. So it means we really need to do something, especially in the testing of drug sensitivity, but also in finding cases of those who could also be facing drug resistance, and also to appeal to our service providers, especially the manufacturers, to do more, especially coming up with drugs which could be more sensitive than the ones which we are using at the moment. In terms of TB preventive, we are making it available, especially for those who are living with HIV/AIDS. As I'm talking now, we have about 210,000 people who are also receiving TB preventive treatment of those who are living with HIV/AIDS. So lastly, I just want to say thank you for this interaction. I'm happy that the people from different sectors here, like I said, we have mentioned challenges. It is very important. Issues of infrastructure, we cannot just isolate the disease itself. Because to manage it, we need infrastructure. To manage that patient, we need human resource as well. Honorable Minister has already said how we were affected during COVID, because most of the staff which we had, they had to attend to COVID patients, and COVID being as infectious as it was, we could not afford it to also have them treat the other cases. So when we are looking at these issues, I would want that we look at how best we manage. We need infrastructure, we need human resource, and of course we need the drugs for the same. And of course we also need modern diagnostic procedures, equipment for our people. Thank you so much.
Honorable Minister, thank you so much. Indeed, very practical, comprehensive overview of everything that's needed across the spectrum, putting the patient at the heart of the response and also looking at the co-epidemics that exist. So thank you so much for your intervention. We are now pleased to have with us Her Excellency Ms. Stéphanie Sédou, French Ambassador for Global Health, France. France has been prioritizing global health, especially in the fight against infectious diseases, reinforcing the multilateral approach to global health issues via strengthening of the World Health Organization and supporting an equitable response to the COVID-19 pandemic. And also we are very appreciative of the WHO Academy established with your support in Lyon. So thank you for all of the support, and we look forward to hearing from France. The floor is yours, Your Excellency. Thank you. Thank you very much.
Is it on? Yes. Okay, great. Thank you very much. Excellencies, ministers, my co-panelists, ladies and gentlemen, it is so urgent that we put our heads together and gather the right kind of mobilization against tuberculosis on the eve of a major event, which is the replenishment of the Global Fund happening tomorrow. I am energized by the testimonies which we've had from yourselves, ministers, as well as the Minister of Indonesia, and you show indeed what political commitment as well as expertise how that can make a difference. The commitment is key. Indeed, thank you for the introduction. France remains a very strong supporter of TB efforts worldwide, essentially through our contribution to the Global Fund. We've been the second donor historically since the beginning of the Global Fund, with a contribution of well, it's in euros, it's less, so I'll say it in dollars. It's over $6 billion since the beginning. We are also an active board member, and we were very pleased that the board discussions this year prior to the replenishment led to an increase of the share of Global Fund financing, which will be devoted to tuberculosis. It's probably not enough, and there was an absolute emergency to do so, but it is the way to go. We're very pleased also to be a board member of Stop TB, which does the go-to technical partner that does such amazing work, and very happy to share the seat with a very committed partner, Japan. We will hear from Japan later. So the COVID pandemic obviously turned everything upside down and set us back in a way which is absolutely tragic. In the midst of the pandemic, we were happy to hold in France, in Toulouse, the vaccine summit, which delivered very promising and exciting possibilities from researchers all over the world, quite a few of them European. And we also, of course, it was a virtual conference, which was unfortunate due to COVID, but COVID also lent a new urgency to our discussions, because we saw what could be done, as we were reminded by a previous speaker, in terms precisely of a world pandemic. We must do the same for the next tuberculosis vaccine, clearly. The challenge will still be equitable access. I'm not going to say, not as well as you did, Minister, how important primary health care is, but it is all linked. And one of the challenges we have is definitely going to be equitable access. For this, I want to commend the work that we do with UNITAID, an amazing agency that does research, development, and innovation. And they are in the room. Philippe Dunton, the executive director, is here. Maybe he can give a few examples later. But definitely developing the pilot projects, the prototypes, which show how innovations can be brought to the people, testing the model of care, as well as the solidity, let's say, of the medical, biomedical response. So that's a very promising formula, and definitely France will remain committed to supporting UNITAID, which is key and vital in what the Global Fund can do in the future, in the next 3 years in particular. Also, of course, WHO, it is key. The Director General gave us the timetable. The key high-level events under his leadership, we're gathering everyone in the room, are absolutely key. And it is the best thing that can happen, that we can have this, that we can have the high-level summit again in 2023, in a year's time. And like you said, Minister, time is of the essence. Only 8 years to go. In some ways, this helps. I mean, we can actually have a countdown to the next 7 years. We must start it now. You have started it in your respective countries. And I believe that this is something that collectively we could definitely find support. And so it's very timely that we're having this event next year. And I would like to finish my intervention by pointing also that France has been active supporting a global fund mechanism, l'Initiative, which is put forward by Expertise France our technical partner agency. And just to give you a flavor, and I'm sure that they can develop that much better than I can, but focusing exactly on what you say, Minister, which is the model of care and the very concrete ways in which pilot projects can make a difference in country. For instance, there's been a multi-country program, TB Speed, which is also supported by UNITAID, which helps enhance the diagnostics among children, and so that there isn't the situation which the young lady who testified so well earlier said, that so that the diagnostics do not that are effective, and that no TB cases fall through the cracks. And this is done with children with acute pneumonia. This project has showed efficiency with new testing methods. Also projects in Côte d'Ivoire, for instance, in Abidjan and secondary cities as well. And this is an outreach specifically to drug users, and it works. Community health work works, peer-to-peer operations work, and including TB local clinics as well, which is a key aspect. So I'm going to stop here and say, tomorrow we need to really get the 18 billion, which will help end TB. France will remain committed. Thank you very much.
Thank you, Ambassador, for your strong commitment as well, and your powerful words, and the support from France. Yes, we do look forward to a very successful replenishment with everyone's support. I'd now like to turn to Ms. Lois Pace, Assistant Secretary for Global Affairs, Department of Health and Human Services from the United States of America. The US government is the biggest bilateral funder of efforts to end tuberculosis worldwide, and we are extremely appreciative for the support from the US government, especially through the US Agency for International Development, USAID. We've been working closely, and TB has received support for decades with USAID support, and we're especially grateful for your leadership in efforts to ending TB and support in countries and globally. Ms. Pace, the floor is yours.
Well, thank you for that gracious introduction, and thank you also for this wonderfully loud microphone with my mask on thing. I am just going to do my best to follow all who came before me, of course, with warm regards to DG Tedros and Minister Budi in their absence. Their leadership has really been special, not just for TB, but across global health, and of course, acknowledging the honorable ministers here of South Africa and Malawi. Thank you for your interventions. To my fellow panelists, of course, I always enjoy partnering with you both, as well as with others around the room who are represented, including civil society. And I just want to thank Jackie as well, you for telling your story and for grounding us in the real experience. And as you said, I can appreciate your comment about survivorship and the fact that you shouldn't have to be a survivor, although we are very glad that you're here, so that we can end this fight once and for all. So I will, gosh, Stephanie, you stole all my thunder, but Ambassador Seydu said it so well. We really need to come together around this issue, and we're obviously in an important moment now with the Global Fund replenishment upon us. We in the U.S. are very proud and happy to be hosting this year's replenishment, and I know we'll hear more from the Global Fund's leadership a little bit later. But look, we are all about finishing this fight, and it is about finishing the fight across the three diseases. As Ambassador Seydu said, we have some really important conversations as a Global Fund board about how TB fits into the mix and the fact that it has been left behind, and we have to do more to ensure we continue to lift that up and track its progress or address it when we are falling behind. And so rest assured, know that this is something to which the U.S. has been committed, as you said, with our partners at USAID, but across U.S. government, and will continue to be committed. Just as an example, And because I'm here representing the Department of Health, I'll pull from our department as well. I think people are well aware also of the work of the CDC, and I know I have a representative not just from USAID but also CDC here, so please find them later. But I know our CDC is in particular working or leveraging the PEPFAR program to identify these cases of TB so that we can diagnose them and that we can put people on treatment. And I think that is going to continue to be important, obviously, as we've heard, but something to which I know our CDC and USAID agencies are going to be committed on the ground. We can't forget, though, the research agenda, and I'm really glad that Dr. Tedros talked about this as well. So our National Institutes of Health has been a really major funder of TB research. And I think the US overall has put a lot into the space. I think by some accounts, we make up close to half of global investments in TB research. And that's key, right? Because we need these innovations to really help us break through and facilitate this additional progress that we hope to make over time. Just a couple of other points too. Dr. Tedros also talked about how TB connects to two important narratives that we're hearing a lot of in recent years, and also that we're going to be tracking over the next year. So one is global health security. I mean, we're in it, right? We're in it now. I'm still got my mask on. But TB is an important piece of that. And I think a lot of the advocates, thankfully, have talked about the linkages between TB and this mantra around health security, but also the link and important connection between TB and health systems, or UHC, as Tedros said. And you'll find going into next year, right, that we're going to not just have the high-level meeting on TB, but we're going to have high-level meetings across these other areas. And so the question I tend to ask myself, and for people who know me, you know that I came from the advocacy community, is how we connect these dots, right? How we tell this story across those really important work streams so that, we don't find ourselves kind of trying to move between disparate silos, but rather we're messaging this so that it makes sense to the broader global community, right? And so that we can mobilize these resources that are required, we can grow or sustain the momentum we need to truly reach the finish line. Last thing I'll offer relatedly is a question of, or maybe even a call to action as to how this all connects to the Sustainable Development Goals. I mean, coming into UNGA and maybe for the first time not hearing as much about the SDGs is a little disheartening. I'm glad it was raised today and it's coming up in conversations, but and thank you, Honorable Minister, for really sort of saying, look, we still have these 2030 goals that we need to that we need to hit. 2015 was a big moment, and I think up until COVID, we talked a lot about it, and we've been distracted, understandably, over the past few years. But it's time to get back on track. It's time to remember that we set these goals for a reason, and they're not just goals, right? It's an opportunity for us to link these important issues like TB to other critical human development priorities. So we talk about equity, we talk about poverty, we talk about the people who are really being left behind. And I'm sure we RTB and people like Jackie can tell us even more. We meet them every day. We read these stories, we see them. Let's bring them back to what it is we're doing. Let's remember that we're not just trying to end a disease, but we're trying to save lives. Thank you.
Thank you so much, Ms. Pace, for connecting all the dots, bringing us back to the SDGs and the fact that indeed we cannot end TB just by looking at TB alone, but looking at all of those multisectoral elements. And we're also very appreciative of the support of the US government across TB, across health, and of course also especially on TB research as we are looking at bending the curve and going to the next level. Thank you. I'm now pleased to invite from Japan, which is a country which was our co-facilitator for the 2018 UN high-level meeting on TB, Mr. Eiji Hinoshita, Assistant Minister for Global Health and Welfare. Japan has been leading efforts on universal health coverage. In fact, Japan is one of the success stories in driving down the TB epidemic successfully and has supported in placing a spotlight on TB in front of heads of states at the high-level meeting. So we're very grateful for your support, and thank you for being here, Mr. Hinoshita. The floor is yours.
Thank you. Thank you very much for your detailed introduction. And we would like, honorable ministers and the panelists, distinguished guests, and ladies and gentlemen, I would like to slightly touch upon the history of Japan's TB response. And it gives me a great pleasure to have today, and I'd like to express sincere appreciation to the government of Indonesia and the WHO for co-organizing this important side event. I would like to highlight 2 points. Reference, 1, Japan's history of how we address the TB, and 2, Japan's contribution to the global TB response. First, I'd like to introduce Japan's successful history in how we address the TB. In Japan, since 1930s and 40s to 40s, TB infected many citizens and became the #1 cause of death. Then Japan started its TB approach with TB prevention law legislated in 1951. Based on this law, the government of Japan established a program for screening and treatment of TB all over the country, followed by the registration and management of TB patients. These interventions contributed to the remarkable reduction of TB patients by 10% annually, the fastest speed in the world at that time. In addition to this, the introduction of universal coverage by the National Health Insurance system and allocate public funds for TB treatment greatly improved the access to medical services and reduced the self-burden. TB-related expenditure was more than 25% of the overall health expenditure at the time, and I would like to underscore that this was managed solely by domestic financing. Finally, in 2021, for the first time, the rate of TB fell down 10 per 100,000 population in Japan, and Japan is now officially a low TB burden country. The second point is Japan's contribution to global TB response. For over 50 years, as a country with those experiences, Japan has continuously given support to the global TB countermeasures, in particular through technological support to WHO. Through the Stop TB Partnership, Japan supports the provision of innovative diagnostic equipment and drugs to TB endemic countries. In particular, we target to reach and treat children with multi-drug resistant TB. Japan has been also supporting the R&D of medical supplies through initiatives including the Global Health Innovative Technology Fund and UNITAID. Last but not least, the government of Japan has been providing approximately $4.1 billion to the Global Fund. As the Global Fund provides 77% of all international financing for TB, we look forward to the continued coordination between the Global Fund and the TB actors to lead the fight against TB at global, regional, national, and community levels and enhance mitigation efforts to regain lost progress caused by COVID-19. Ladies and gentlemen, this side event was well timed toward the next year's UN meeting on TB. Japan co-facilitated the 2018 high-level meeting on TB with Antigua and Barbuda in close coordination with the WHO and Stop TB Partnership. We expect that next year's UN high-level meeting on TB will be well coordinated and ensure synergies with other health-related high-level meetings, including on universal health coverage and health security. We expect further leadership and coordination by global partners on TB in close collaboration with civil societies. In conclusion, Japan is continuously committed to taking the leading role in global health, including TB, underlying strengthening health systems towards universal health coverage and international society's goal. I thank you.
Thank you very much, Mr. Hinoshita. We are very appreciative of Japan's leadership, and thank you for sharing the work undertaken both at the national level and the global level, especially on health and on TB and beyond. Very appreciative indeed. So with this, given that we are now coming close to time, we'd like to thank the honorable ministers, other distinguished speakers for your powerful interventions. We appreciate your continued support and look to you for your leadership on ending TB. We'd now like to close the session and move to the second session. So thank you very much, distinguished speakers. Okay, so now while we move to the next panel, so just like to note that we have refreshments on the side, so please feel free to grab refreshments as you sit and listen to this very interesting, to the interesting events from distinguished speakers at this event. So now let's move to the second session. We are very pleased to have with us our close partners and leaders to end TB at the global and country level. We have with us Global Fund, Stop TB Partnership, United, Wellcome Trust. The focus of all distinguished speakers in this panel will be on the contribution towards strengthening and sustaining multisectoral action and progress towards ending TB in the context of the COVID-19 crisis, the new developments, especially looking at R&D research, the new innovations we have in place, how we can push for greater financing, and of course, looking ahead to the second UN high-level meeting. So we've heard from countries, now we look to our partners. So I'd like to invite on the stage Lady Rosalind Morauta, Vice Chair of the Global Fund, Dr. Lichika Ditiu, Executive Director of the Stop TB Partnership, Dr. Philippe Duneton, Executive Director, United, and Sir Jeremy Farrar, Director, Wellcome Trust. Thank you for being here. Please. So we're going to keep this session very interactive, and we're very pleased to have this distinguished list of speakers with us, and we're going to have it more in an interactive Q&A style. So thank you for being here. I'd like to start with Lady Rosalind Morauta. Thank you for being here. We are very supportive of and commend Global Fund's seventh replenishment to fight for what counts to defeat HIV, TB, and malaria, end health inequity, and protect humanity from pandemics. This is critical for countries and for the millions suffering and dying from TB, which remains one of the top infectious killers worldwide. How can we leverage the spotlight on increasing health investments to ensure that the TB response is allocated sufficient resources, financing to strengthen efforts to end TB in countries and to close financing gaps? Thank you. Over to you.
Thank you very much. I just want to make three quick points. The first is that TB investments work. They deliver results. They save lives. Since the inception of the Global Fund 20 years ago, we've invested $8.5 billion in TB, which, as our Japanese colleague pointed out, almost 80% of all external funding for TB. And in that period, deaths from TB have reduced by 21%. Where are we today? In 2021, in the countries where Global Fund invests, there are 5.3 million people on treatment for TB, 110,000 people on treatment for multi-drug resistant TB, and 1,600 for XDR TB. So clearly these investments do work. And the second point I want to make is the power of partnerships. The results are absolutely an indication of the strength of the partnerships between donors, implementer governments, NGOs, communities affected by TB, all working together to design policies and programs, mobilize the resources, find and treat people. It's a very firm position of the Global Fund that it's only through a country-driven, coordinated and multi-sector approach involving all relevant stakeholders in the decision-making process will we continue to save lives and achieve the goal of ending TB by 2030. The involvement of communities in this is critical to ensure a rights-based and gender-responsive TB response. Well-mobilized and engaged communities are fundamental. So the Global Fund is investing to support countries to engage community health workers, especially in hard-to-reach communities, to find missing people with TB, as well as to administer anti-TB drugs. Another critical element of success is coordination of effort. And I'd especially like to acknowledge our technical partners, the powerful advocacy of the Stop TB Partnership, the support of WHO and other UN agencies, organizations like Welcome, and of course, UnitAid, with whom we work very closely. So partnerships work, investments work, but we need to do much more. The COVID crisis has knocked us back, as previous speakers have acknowledged. The results in 2020 were disturbing, with increased deaths that year and around 1 million fewer people on treatment compared with 2019. And this was the first time in the history of the Global Fund that we saw reversals in progress. We mobilized very quickly to try to respond and to support countries to respond to the COVID crisis by deploying $4.4 billion, thanks to additional funding from our donors, particularly the US and Germany, Japan too. And that has allowed us to begin to get back on track. And many countries by 2022 indeed had got back on track. India, Bangladesh, Indonesia, for example. But much more funding is needed. Indeed, a lot more funding is needed. With an $18 billion replenishment, which is our target for the pledging conference tomorrow, funding for TB would increase by approximately 40% compared to the current cycle. The $18 billion will allow us to cut the death rate from HIV, TB, and malaria by 64%. It's an astonishing result if we can achieve it. Save 20 million more lives and build a much more healthy and equitable world. For TB, the $18 billion would result in a reduction of new TB cases by 27%, from 8.5 million to 6.2 million. It should translate into a reduction in TB deaths, including people with co-infection HIV TB, by 59%, from 1.4 million to 570,000 by 2026. But money from the Global Fund, from the replenishment, isn't enough. While we provide almost 80% of external funding, that's very small compared with the amount that national governments are spending on TB. And governments will also need to increase, at the very least, maintain funding for TB. We heard very promising news from the Indonesian and South African and Malawi ministers on their commitment to increasing support for TB. The role of TB partners will be important for advocacy. We need to work together to catalyze the funding. And implementation of the new strategy of the Global Fund is absolutely hinged on this: effective investments, powerful partnerships, and the mobilization of more funding. Thank you.
Thank you so much, Lady Roslyn. You've really highlighted how the replenishment is really going to make a big difference in efforts to ending TB. And I think we wish us all a very successful replenishment, because it is, for all the work that we do and for the people suffering and dying from TB, it's going to make a big difference. So yeah, we're all rooting for the Global Fund to fight for what counts. Thanks. I'm now very happy to turn to our close partner, Dr. Luchika Ditiu, Executive Director of the Stop TB Partnership. Luchika, you, at the Stop TB Partnership, you recently highlighted the widening investment gaps in your new Stop TB Global Plan, given new tools and guidelines. What do you see as important actions to close these funding gaps? And of course, Stop TB has been playing a very pivotal role in engaging with communities and civil society. So would appreciate hearing your take on how we can strengthen the role of communities and civil society in boosting investments and actions towards ending TB. Over to you, Luchika.
So thank you very much, Monica, and we miss Teresa, but I think you are doing very well. So, you know, it's life is bringing a lot of challenges ahead of us, but I think it's very important we are all here. I'm very impressed. I was telling Jeremy here is like kids are left alone because the principals left, but actually it's not true, because the Honorable Minister of South Africa is with us. Remain here. Thank you very much. And I see also the colleagues from US and France as well joining us. You know, sometimes people come and speak. They have a lot of other commitments, I understand, but you feel a bit sad because, you know, there might be some interesting points raised by others, such as this amazing panel. So I want to make 3 points. And I want to say we have here the Minister of South Africa. South Africa is a champion on TB for many years, and sir, you pushed and rolled out the tools, you pushed the agenda on R&D, you pushed the agenda on access. There is a lot of burden in South Africa, but you always wrestle with it, so thank you very much for that. But I wanted to, and I wanted to highlight that, and I have here in front the team lead from Indonesia for all communicable diseases, Dr. Imran. That what the Minister of Health of Indonesia said something very powerful, and that's what we need to have in a lot of other countries. Because he said, if we saw that during COVID we were able to test 64 million people and find 6 million positive, why we cannot test the TB people who expected to have TB, and find in Indonesia 90% of our 900,000 people? And that's the mindset that we need to have. And I know this is not a direct answer to what Monica said, but for all of us here in the room, half of this room are preaching to the choir, if not 60%. We are all in this business of TB for a long time. But we also know very well that, unfortunately, a lot of our countries are not making their national strategic plans strong and comprehensive enough to really say, okay, what it will take me to find, diagnose, and put on treatment 90% of all my people. Because that's when the rubber hits the road. That's when it is like, how do I reach my 90% of 1 million cases? How much it will cost? And you know what? Very often our national strategic plans in TB, I heard today that it's a similar situation in HIV as well, actually, is not looking at finding and treating everyone. And Jackie, you had a very good point there that you were going in circles. And that is because We were never funded enough in TB. And people are in a lot of, when you are used to drink water and eat bread at every meal for a life, when somebody says, but you can drink more and you can have some cake and food and some steak, you are like, well, you know what? Nah, I'm not sure it's there, okay? So we need to have a call and the pressure that the national strategic plans should be broad enough and ensure that every single citizen has access to the latest recommended tools, to the latest recommended policy that is budgeted. And that is what drives you. And then you go and say, okay, from the Global Fund, and I have to say something about the money there, I'll get something. And I need to put from my domestic as well. And I will remain with a gap, yes, but I have it there and I know, and if a donor is available somewhere, sometime, I come with my request or with an unfunded quality demand for Global Fund. But other than that, if we don't have the plan, we run like chicken without heads in the last moment to put in this kind of plans. Now, why is the situation with the funding for TB so dramatic? It is because the domestic, it is because in TB, the money are coming from three sources. One is domestic. And on the domestic, I agree that the 18 billion obviously is what we need to have at least, but it will not lead us anywhere if it's not paired with a huge increase in the domestic resources. In TB, we expect the domestic to increase 3 times if we want to go anywhere. Without having that, the 18 billion will be great. Don't take me wrong. It will save all the lives, but we will not end anything. We will not end any TB. So, put a cross and say, okay, we defeated. We should not be defeated. So one part is domestic. Now, on the domestic part, sorry to say, with few exceptions on the African continent, one being South Africa, in the African continent, the domestic money going into the TB response is very low. It's below 10%. I come from a very large country with a high TB burden, which puts just 7% of what is needed in TB from the domestic budget. Basically, 93% in that country is a gap. Ta-da! What can you achieve with a 93% gap? Nothing. It comes Global Fund, which is our second source, as very well Lady Ross and you all know. And Global Fund is putting a lot of money in TB, don't take me wrong. But, and what it is right now is $700 million a year. That's what it is right now from the Global Fund for TB. What is needed is like 5 times more. At 18 billion replenishment, we go from 700 to 1.1 billion. It is indeed a 45% increase, but it's like from one slice of bread to a slice of bread with a little bit of butter. That's what we get. So with 1.1 billion, we will go a long way because we don't have other money. Again, don't take me wrong, but it's not the answer. Because normally it should be in the Global Fund eligible countries around $4.5 billion. And then we have, and thank you very much to USG, we have some US money, around 300 million a year that are going as well in this pot. That's all. We don't have the luxury of other donors putting money left and right to build up. That's all. So in the country that I was telling you had 7% domestic, it came Global Fund and US with another 24%. So that country had 31% of their needs to fight TB. 69% was a gap. If you take a car to go from here to Washington and you put fuel just for a third of the trip, there is no way you reach the destination, right? You will even say, what the fuck, I'm crazy. So you need to find something to fill the 69%, and that's what Monica said. What do we do with the 69% gap? I don't know, we push the car, we go by walk, we don't give up. That's the first. But the second is we are smart in doing few things. So what we do is domestic needs to increase, sorry to say that. And I'm sorry, but on the domestic, we are also making a mistakes, because if TB goes and fundraise for TB, HIV goes and fundraise for HIV, malaria for malaria, NCDs, the poor ministers of health and ministers of finance will lose their mind. So we need to fundraise for things that will help all the people, and look at what Japan said that it happened there. Let's put in place tools that can help multiplexing, diagnosing more than TB and other diseases. As you heard, for now we can do X-ray with artificial intelligence. You find cancer, you find other diseases, rapid molecular diagnosis, and so on. So one way is domestic needs to increase. The second thing is, can we be innovative? And the Global Fund, and I want to thank as well, is trying, working with World Bank, push and pulled by us, Joanne and other colleagues here, to ensure these buy downs, in which I think India was part of it. There are conversations with other countries now, in which using the Global Fund money, the loan from the Global Fund, from the World Bank can be paid the interest, and then it becomes attractive for the government. I know that there are other ways to look at these things. I don't want to go into it, but without speaking it openly and without being very clear what will take to end TB. Stephanie Seydoux said something very well. It's in 7 years. By 2030, we should end this. Why don't we walk backwards and say, and we have the global plan for ending TB. I know that 90% of the room has no idea what it is. I encourage you to take a look, because it's actually a fantastic work. It's very well budgeted, and it tells exactly that, how much money you need, and it's a lot of money. It's like 200 billion between now and the end of 2030. But it is what we need to have to put these things in place and what we get there. I want to touch on something, and I'm ending, and Monica, don't give me ever the microphone, on civil society and communities. The civil society and communities, it's very difficult, because in some places, and you heard DG Tedros saying we need to put TB into the primary health care. Yes, where primary health care exists and it's able to do. In a lot of other places, civil society and communities are the ones that are the first front runners. And we were pushing a lot from the Stop TB side on not only having the TB programs that are becoming gender sensitive, respecting the rights of people, inclusive, looking at and embracing the vulnerable groups, but also having them as the frontline providers of care. And in places, because they are the first ones there, and they can be, these investments should not be just for TB, they can do HIV, they can do malaria, they can do NCDs. Create an environment in which these people are the first ones there and are equipped and ready to step in. Ebola came and left. We don't have too much behind that. If Ebola comes again, we start again from the scratch. COVID learned us something, but I'm not sure we are on the right place. By the way, in many places here in US, ventilation is a disaster. And that's the first thing for airborne. Open the windows, ventilate properly, circulate the air. Anyway, that's a different discussion. I'm trying to say, and some of you might not be able to follow what I'm saying here. What I'm trying to say, I need to be honest. What I'm trying to say here is this. Without investing smart, the global fund money and the domestic money, in being able to create capacities on the ground with civil society and communities, with primary health care, that are the first ones there, without investing in diagnostics that can serve more than one disease, and without making sure that we plan and we budget interventions that can embrace everyone that is affected with TB, we will never be able to end these diseases by 2030. Thank you very much.
Thanks so much, Luchika, for your passionate and powerful intervention calling for an increase in much needed investments and for greater engagement of communities and civil society. Much appreciated. I now turn to Dr. Philippe Duneton, Executive Director of UNITAID. We are very appreciative of UNITAID's leadership in advancing research and innovations, notably through investments in scaling up TB detection and in bringing down costs of life-saving tools that you've recently announced. Could you please share how UNITAID is leading efforts to harness research and innovations to accelerate the TB response, building on lessons learned from the COVID-19 pandemic? What can we leverage on globally and nationally to reach NTB targets? Look forward to your perspectives, Philippe.
Thank you. It's always difficult, but it's not the first time for me to speak after Luchika, of course. And we met this morning and she said, it's a very serious issue, but let's have some fun. And I think that it's also part of the way to think. UNITAID is about innovation. for health, including, of course, TB. TB is one third of our portfolio. It's very important. If you see the panel before us, we had expressed support from France, historical donor, but also new supporter like Japan. We discussed yesterday together about TB. But I think United is about impact, of course, in terms of public health, innovation. It's about partnership. It's about people. Talking about people, I was really moved by your experience, Jackie, because I think that you nail it down. I think that your challenges is not only your challenges, is the day-to-day experience of people coming through diagnostic, treatment, and of course, access overall to care. So it is this in mind that we have really invested in prevention of TB among HIV people in particular, because of the pressure of South Africa. South Africa came to us as United, but us also as a partner with Stop TB, with the Global Fund, by the way, with PEPFAR. So we had the mandate to negotiate with industry to have better drugs, also to develop generic markets. I can take a lot of examples, but I think that's how it works. I was in a panel with the Ministry of Malawi just before, talking about HIV. It was exactly the same. Just to point out, you mentioned your investment, in particular in diagnostic, because the reality is very difficult for people to get access to test. So the fact that we need to, and we are doing that, of course, we are colleagues of Global Fund and others, but to have better rapid tests. So that's the agreement, what we have with FINE in particular to develop that. But also we need to have a way to use the multi-platform disease, because it's very important to diagnose not only TB, hepatitis C, HIV. It's something, you mentioned it, of course, Rutika, but it's absolutely key. I don't want to be too long, but I think that we know all the situation about COVID-19 and the impact it has. So there is a lot of lesson learned, and we should learn, and we should talk about it. And I think that there are three things that for me are quite important, and we have been together with Jeremy and others in that. I think that the question of access is very important still for all the tools. And we have been shoulder to shoulder with Peter on that, with Tedros, with UNICEF, to make the point that it's important to have transparency of price, to have a access policy from the pharma industry to allow as soon as possible to have generic markets, and also good price for the test. And also to think about what I call not local, but continental, regional production. So it's part of the question of access for the future. The second point is that we know that we need to do better to work with countries. And I think that's one important thing, and I think of my colleague Bill Rodriguez, who said all the time that, we can make mistakes once, but not twice. And I think that it's really important to say, okay, control of infectious disease is always the same. Is when you have a vaccine, you have to use a vaccine that works, but if not, it tests and treats. So we should not reinvent the wheel all the time. And the last point is, I know there is a lot of discussion about pandemic response, to say preparedness and response, and I'm a little bit anxious, to be honest, because I think that we need to think the response at the same time. An example of that is access to oxygen. That was not a priority before COVID, as it is a priority in terms of public health. So we organized a response with a specific O2 task force with all the colleagues, NGOs on the ground to assess their needs. And then the Global Fund and of course USAID can put, of course, the resource. We negotiate oxygen liquid that didn't exist. But to be honest, all the ministers I've seen, in particular from Africa, said, please continue because we understand the COVID-19 situation, but we understand the day-to-day issues. And I get this to say, if we want to address pandemic situation, and TB is a pandemic, is an old pandemic, but it's the actual pandemic, we need to do better our job together with the country. The day-to-day job needs to improve. That's the only way that we have a chance to defeat, of course, with the resource, TB, but to face another pandemic that will come at some point. Over.
Thank you so much, Philippe, for that very comprehensive overview of how, through the power of partnerships and innovations, we can really go up to the next level. Very appreciative.
A fully funded global fund, of course.
Indeed, we're all echoing this. We need a fully funded global fund. So we're all in this together. So now we're very pleased to have with us our close partner, especially in TB research and development, Sir Jeremy Farrar, Director of the Wellcome Trust. Safe and preventive vaccines are important public health tools, as you all know, to curb disease transmission, improve antimicrobial stewardship, and to avert catastrophic costs. Heads of state in 2018 in the high-level meeting political declaration committed to deliver as soon as possible new, safe, effective, equitable, affordable vaccines. However, unfortunately, no new TB vaccine has been licensed for 100 years, and the further testing of the M72 AS01E vaccine candidate has been delayed due to several challenges. There are very few candidates in the pipeline, and a survey-based report from the Treatment Action Group demonstrates that funding has remained relatively flat for TB vaccine research since 2018. In your perspective, Jeremy, what are the 3 top strategic and scientific priorities for accelerating the development and availability of effective TB vaccines, including drawing on lessons learned from COVID vaccine development that may be prioritized in the upcoming 2023 UN high-level meeting? Over to you.
Thanks very much. I'll say it at the start just to make sure that we need to fund UNITAID, Stop TB and the Global Fund all together. I'll say that at the start just so, you know, are you on side? Like Philippe, it is really difficult to follow such a panel and certain individuals, and whether I go before or after, I always have to apologize. If she swears, don't take it personally. It's just part of the way that she is. So if you heard the odd swear word there and the children were in the room, please, and also because she always overruns. So if you do have to leave now, I won't feel embarrassed if people have got a 3 o'clock appointment and you need to leave for. To be serious, I'm yes, now head of Wellcome, but for 20 years lived in Vietnam, where I was a doctor on a day-to-day ward round, and most of my work was actually in tuberculosis, HIV, with a particular interest, because originally I trained as a neurologist in TB meningitis. We should not forget that actually TB is about more than just the lungs, and it affects adults and children in other parts of the body as well. It is a whole of the body disease, an infection, which we should not forget. I also enjoyed, Jackie, your comments. I've not had TB in the sense of being ill with it, but I am one of 25% in this room, probably, that is infected by TB. And we should not forget that amongst us, all of us, including myself, are people who are infected. And were we to get other infections, HIV, or we had needed treatment for cancer or many others, we could easily become a patient with TB as well. The other thing you mentioned is very typical of a TB patient. They spend a lot of time going through a cycle of different clinics and doctors, maybe because they're in communities where TB is not high on the agenda. That has implications for delaying diagnosis. It also has implications for abuse of other antibiotics. And there is no end to the pandemic of antimicrobial resistance without us resolving the issues around tuberculosis as well. The TB, I think, has a much bigger connotation as well. I think it is, of course, and as an infectious disease doctor, it's about the infection, but it's also about the sort of society that we want to be part of. It is bigger than actually the disease. It is about inequality. It is about poverty. And it is about the neglect of a disease that we have come to accept because it may affect people somewhere else. And the truth is, with a very migrant population, with mass movement happening around the world, that TB is on all our doorsteps as well. It is no longer a disease that you can consider as not part of your communities. All of our communities, and I hold a British passport, all of our communities are becoming more inequitable. On all of our borders, some of the highest levels of drug resistance in the world are in Eastern Europe, in Russia. The tragedy unfolding in Ukraine at the moment will make that worse. So TB is in that precarious moment when the COVID pandemic also demonstrated that TB health systems are so vulnerable to anything happening beyond TB that as soon as you put an additional pressure on the system, TB is the one infection that I think goes back the fastest, and we've seen that in the last 2 years. It is also hard scientifically. It's a tough gig to work in TB. It hasn't attracted the brightest and best of the young scientists who have been attracted more actually to HIV and malaria over the last 20 or 30 years. And I think part of that is because we've dealt with it, if it translates, as a Cinderella of those big three. It has been neglected, it hasn't attracted the best mind, it hasn't had money, so you don't think you can build a career in a research in tuberculosis. And if we don't attract the bright young scientists, social scientists, biomedical scientists into this field, I don't think we will achieve the warm words that we hear at all of these conferences and continue to hear them. And I don't think, and this is somebody from the TB community, that we have got the right balance between anger, frustration, the voice of people with tuberculosis, but also a sense of hope. I think we've not got that right in ways that we could learn from other conditions about how we have the anger and the frustration that we had during COVID. We had to get there quickly, and we have lost some of that, and we've also lost a sense of hope, and a sense of nihilism has taken over, and I think that's affected the way we see TB. It is a moment, and I think probably for the first time in my career is a moment when I think we are at one of those inflection points in history. And it's very difficult to see it when you're at inflection point in history. You look back in 5 years' time and you think that was when it changed. But actually, the most important is to realize you're in that moment when it's there and seize the day. Because I think for the first time in my research and scientific career and clinical career, I think we are on the verge within the time frame that we've talked about of actually making the difference that everybody wants. And I probably would not have said that, say, 5 or 10 years ago. What is that? It's what Philippe does on diagnostics and therapies, shortening therapies, as we heard, and making them simpler, not injectable, and less toxic. I think that's there and will come in the next coming years. It is about vaccines, but it is also about putting vaccines with communities in a way that communities will wish to have and trust to have. If one of the lessons of COVID is just because you have a magic bullet, don't think that communities will accept what you regard as a elite scientist in an elite ivory tower if you don't build the trust with the communities before you have the interventions you want. And one of the things I think we need to go away from these sorts of warm conferences in lovely cities, all wearing nice suits and mostly people in ties. We need to work at community level in order to put the research and science that's coming with communities, not to communities. And if we don't do that now before we have the interventions, don't try and build that trust after you've had the interventions. So I do think this is a moment to seize. I'm the most optimistic. I do believe this decade we will have effective and safe vaccines for tuberculosis, and we should now be planning for that with communities so that if I'm right, we're not then planning how we implement them after we've got them. Let's do that thinking and planning now, and let's put the main lesson to me from COVID, which is if you don't build up issues of access and equity and manufacturing and trust before you have the interventions, you will never deliver the benefits to communities that the interventions will possibly bring you. So my request is we treat these lovely rooms and these meetings and warm words with the privilege of being here. But then when we leave here, we don't just treat them as warm words, but individually and collectively in our organizations, we say we are going to change and we're going to seize the day of that inflection moment and commit to doing it when we leave these rooms, not just when we're in the rooms. Thank you. in that.
Thank you so much, Jeremy, for that very optimistic ending and last word. Very inspiring, and indeed, we need to start working right now with communities, looking ahead, and yes, very optimistic to have new vaccines this decade if we all work together as one. So thank you for that. So we've come to the close of the session. We were really hoping to have an opportunity to get questions from you all, but we've hit the mark. So without further ado, I'd like to thank the distinguished panelists from among our partners. They have covered all the key issues, including on, what we need to prioritize looking ahead at the UN high-level meeting. So with that, we'd like to close this panel discussion with deepest gratitude and thanks. And we move now, so please stay on for just 5 minutes for the closing remarks. So many thanks to our panelists. So much. Thank you. All right, so we're now at the closing session. And for the closing remarks, I'd like to invite Dr. Maxi Rondovunu, Director General of Prevention and Disease Control, Ministry of Health of Indonesia.
Thank you, Monica. Distinguished guests and colleagues, I express my sincere gratitude for the support and keep bringing TB into the spotlight and higher attention. Today, Indonesia and WHO co-host the UN General Assembly high-level side event progress and multi-sector action towards achieving global target to TB. This high-level side event bringing together everyone to discuss progress towards global target, ongoing efforts to advance multi-sector action and accountability and preparation for the 2023 UN high-level meeting on TB. Efforts have been done by the government of Indonesia to establish a strong commitment. As Indonesia holds the 2022 G20 presidency, we put spotlight on the TB and build on the outcome of our side event on TB, call to action on financing the TB response. The call to action sought to promote adequate and sustainable financing for the TB response and TB research through multilateral, bilateral, and domestic mechanism. Our focus will also be placed on intensifying TB research and development, notably for new TB vaccine leveraging lessons from the response to the COVID-19 pandemic. We also have a presidential decree number 67 year 2021 on the TB control and prevention as a very high political commitment from our president to ensure all the stakeholders, line ministries, and partners are together to reach the target to end TB by 2030. I am pleased that this conference took up the challenge for us, not only focus on the curative effort as the TB elimination progress, but also generate ideas of how a multi-sector approach with cross-sector stakeholders could create a better environment for TB prevention effort and accelerate the target and to end TB. I do hope that with multi-sector effort, we could address the challenge that lie ahead and create a better environment to enable the acceleration. I wish to take this opportunity to thank Minister of Health and other minister, head of agency, researcher, private sector, development partner, and civil society for your never-ending and tireless support. I encourage all to keep working together and find most effective and efficient step by improving the vaccine, therapeutic, and diagnostic tool. I thank you and wish you safe travel back home to again take up the challenge of ending TB in our lifetime.
Thank you so much, Dr. Maxiren Rondovunu. On behalf of the World Health Organization, especially Dr. Teresa Kasayeva, Director of WHO's Global Tuberculosis Program, who couldn't be with us here today, we would like to thank the government of Indonesia for co-hosting this event with us, notably the Honorable Minister and Dr. Tedros from WHO and our other colleagues. We would like to thank our eminent speakers, both from ministers and from partner agencies and from civil society. Thank you, Jackie, for sharing your story and for your powerful call to action. Thank you to you, our wonderful audience. It's a very busy UNGA week, and we appreciate you making time to prioritize ending TB. It's amazing to see a full house with many people sitting on the windows behind. It's inspiring to see that there's still passion and interest in ending one of the top infectious killers worldwide. By working together, we can indeed make this possible. Together, we can make a difference. Thank you so much. It's time to end TB.